Don't you think that surgery should be the last resort and not the first thing to get suggested?
More and more now, we have these options that allow us to stimulate the healing process that sometimes gets shut down in an impromptu manner because of persistent inflammation. And so the healing doesn't continue to its full effect. But we now have the ability to stimulate those processes so that we can get virtually 100% repair. So that would be, I think, preferable than going and having a surgeon. And there are literally tons of studies out there that demonstrate either the equivalency or superiority of physical therapy even to a surgical intervention that would actually accelerate the deterioration of the joint and then long-term complications with arthritis, etc.
Welcome to Your Infinite Health. Are you getting older?
Are you feeling it?
How would you like to do that in reverse?
We're your host,
Dr. Tripp
and LeNae.
We've run an integrative medicine practice for 13 years.
Together, we have 60 years of combined experience helping clients.
We've helped tens of thousands achieve success in health and live longer, happier lives.
In this show, we'll cover peer-reviewed and evidence-based integrative approaches to creating the health you've always wanted.
We also share professional experience we see in the field every day.
So if you're ready to feel, look, and live your best life, you're in the right place.
Welcome to Your Infinite Health Podcast.
Happy weekend, Tripp.
Hey, happy weekend, LeNae.
So this week I had to take Hayden to, I almost said the vet again. I told somebody I had to take Hayden to the vet. They're like, the vet? I'm like, oh, wait, no. Hayden is the child, not the dog. I had to take him to the pediatrician for his annual school mandated physical. And he wasn't due for shots, but we did sign him up to get the HPV vaccination. And because he's getting it now, he has to do another one 6 months later. And I think then he's good. I think if he was older, he would have to do 3. But I'm telling you the story because while we were there, the tech handed him a piece of paper and told him he needed to answer these questions. I was sitting across from him, so I didn't see it until he was like making a weird face. And so I looked at it and they were asking him to circle how many days in the past few weeks has he felt like the first one was kind of like disaffected, bored. They didn't use the word bored. What did they use? They said something like not interested in doing anything. So I interpreted that as being disaffected. And then the second one was how many days in the past few weeks have you felt depressed, sad, unhappy? And he circled 1 to 2, like the highest rating for the not interested in anything, but then 0 for the unhappy, depressed, and whatever. And so I was like, well, gosh, I think that first question could be misinterpreted. Somebody might look at it and think, oh my gosh, he's having emotional or mental issues, but honestly, he's just a 14-year-old that games all the time and doesn't like sports, and it's 200 degrees outside. So no wonder why he doesn't want to go do anything. And so anyway, I was like, well, they're asking you those questions because they want to make sure that you're not suicidal, that you don't have suicidal tendencies. And I'm not kidding you. The kid didn't miss a beat without even breathing. He was like, oh, because I said that. And then I said, they didn't ask us those kinds of questions when we were kids. And without missing a beat, that kid goes, that's because nobody cared. Harsh.
Really?
Harsh, but like true. Like, I guess the information, I don't know. Hayden goes to a really good school. They're very thoughtful in their approach to teaching. They're very open to teaching in a way that the student will learn the information. So if the student isn't learning then they modify the way that they're presenting the information. Whereas when I went to school, it was like, if you don't get it, you just fail. Like, I feel like most of my teachers were, they were on the latter end of their career. They were probably staying too long and should have retired 20 years earlier. So I got all those postmenopausal women that didn't have hormones.
Right.
Cranky teachers. Anyway, I'm really jealous of Hayden because I'm like, man, I could have been president if I had gone to that.
They were on synthetics.
They were on synthetic hormones. I could have been a president if I had these teachers. So anyway, I'm really excited to see where his educational career takes him. So I thought I'd share that story because you didn't get to be at that appointment because you were working with patients. Speaking of working with patients this week, you've had quite a few. Seemed like the week was heavily inundated with people who...
Regenerative stuff, right?
Yeah, like neck pain, back pain, shoulder pain. Tell us about some interesting... Well, for one, I have one of our mutual buddies.
Well, he was on a podcast too, wasn't he?
Yes. We will not say his name, but he had he works out, and I think he damaged his shoulder, and so he's going to see an orthopedic surgeon. And out of his mouth was like, "I've got to go get shoulder surgery." And I was like, "Dude, don't you dare go get shoulder surgery." So can you talk about shoulder pain and what you should do? And is surgery the only thing that somebody can do? And would that actually even help them?
So a lot of times, obviously there's some trauma involved there, and weightlifting is one of the things that can cause obviously trauma to the joints and the ligaments and the muscles. And the bones, for that matter. So there are a number of different things that can be considered in the origin of the pain. So the first thing to do is to obviously to find out what type of exercises are being done in that, and it just brings up the thought about how people are doing weighted exercise and resistance training nowadays. A lot of times.
You're talking about deadlifting?
Well, dead weights, I think.
Dead weights as opposed to...
As opposed to bands.
Oh,
I think,
okay.
And, using elastic progressively increasing tension as the source of the resistance, as opposed to automatically having the resistance in place. And I think one of the important things there that tends to happen is with the dead weights, you have 100% of the weight that's being exerted at the moment that you initiate the movement or whatever it might be.
There's a lot of people that are like, I follow and am being followed by a fitness coach on Instagram, and he is lifting. I mean, those are some intimidating. And then I saw another guy on LinkedIn. The barbells that they are lifting off the ground, I mean, they look huge.
Right.
And so why are they doing it? First of all, why?
Well,
why are you lifting those things? I don't understand.
Yeah.
What's the motivation for lifting heavy pieces of metal off the ground?
Huh. That's a philosophical question.
Okay. So I don't know what the motivation is because I'm not doing it, but you're saying that when you do it, it can cause problems.
Well, the real issue with dead weights, and that's with any type of exercise, resistance exercise with the dead weight, is that you have 100% of the weight present at the moment you initiate. So your muscles,
lift with your knees.
Yeah, your muscles really don't work like that, right? They progressively recruit the fibers so that they progressively build up more and more weight displacing energy, so to speak. So at the moment that, and they also serve to hold the joint in place, particularly when you get to the higher weights and that. So if you've got a really large weight that you're lifting and it's a dead weight, then your joint and your ligaments and your and the tendons, I guess, in a sharper fashion, are supporting the entirety of that weight. Whereas with the use of a band, a very strong band, if you're using strong weight,
I have never seen a video of a man in his garage with well, not since the 70s when people were wearing leotards have I seen a man with bands doing Suzanne Sommer level leg lifts. And that's what you're suggesting, right?
Right. Well, because it's the bands, they don't have 100% of the weight there or their resistance capability at the moment that you initiate the activity or whatever weightlifting you're doing. So what happens is there's a progressive increase as you stretch the band. You progressively increase the resistance. So it works more like the muscle fiber. The muscle fibers do in a muscle, because they are progressively recruiting more and more weight, more and more fibers and progressively get to that maximum ability. Whereas with the dead weight, it's there all at once. And so
whether or not you start out with a 25-pound weight and then you move to a 50-pound weight and then you move to a 100-pound weight, that doesn't strengthen the fibers. Well, that's still shocking the system.
Well, no, you can progressively gain the strength and increase your muscular fibers and increase your strength. But at the moment, it's at the moment that you initiate the exercise, whatever it may be, with a dead weight, all of it is there. Whereas with the band, it progressively becomes its optimal or maximum, and that protects the joint in that not all of the articular surfaces, the bone, the ligaments, the tendons, they're not at their all at once subject to that weight, particularly if you're at higher weights. And so your muscles are recruited, can protect the joints to a certain degree with that, like with using the bands. And so it's a healthier way to, and you can achieve the same results ultimately, but it's a healthier way and maybe even better results.
So what kind of damages are you seeing from these dudes that are dead weightlifting, or, not even that though, because I think you've had a couple of people that have been in car accidents that have had, comparable damage. Well,
the damage is the same depending on the joint. I mean, what you're doing is you're stretching out if they're shocked with that weight, then you're stretching the ligament. The ligament is supporting the brunt of the energy displacement, and so ligaments are meant to hold the joint in place so that the articular surfaces in that remain where they should be and aren't out of place to support weight on that joint like it should be. So if you all of a sudden apply that weight, then the articular surfaces are actually being subject to a higher degree of force that potentially can aggravate and initiate and or aggravate arthritis and those types of things. And the bone itself actually deforms itself progressively over time.
The bone deforms itself.
Right. So to support the weight that's being placed on it. So based on physical properties and the axis that the forces are in, the bone senses those directions and that directionality, and bone is then reformed in those directions.
Wow.
So progressively over time, you'll see with degenerative arthritis and those things, you'll see basically that the bones splay out.
Ugh,
and
that sounds painful.
Well, no, you don't feel it happening. You don't feel it happening, but the surface of the bone will splay out to redistribute the weight so that there's less weight per unit of square.
Such your bone trying
surface.
Trying to protect itself.
Yeah, and it's physics. I mean, it's like anything. You put something on top. You think about a rubber ball. You put a heavy weight on it, and what does it do? It spreads out. So it's trying to redistribute. That's just the principles of physics. So as that happens, that's why we end up with. That's why in many people over the course of the aging process, will their knees, the surface of their knees will spread out. The surface of their back joints will spread out based on that attempted redistribution of the weight. So
are MRIs picking up on that damage?
Well, yeah, they'll pick that up for sure. I think the question, the challenge with MRI, in particular when you consider the spine, is that MRI cannot tell us the damage of the majority of the ligaments that hold the spine together and the bones in place. It focuses on that the disc and how the disc has been affected by whiplash or whatever.
So somebody who is having those pains, generally the first step is they go to an orthopedic surgeon. Is that the first person
you're talking about?
Well, for like some of the pain that one might realize from dead weight lifting or car accident.
Okay, so with the weightlifting, and I'm not saying that you can't have accidents and can't have trauma with the bands, but it's probably going to be less frequent because of the physiology of how the muscles respond to.
We need a band sponsor. If you're the manufacturer of a band that is physician approved, please call us. Put my logo on that. But my question was, what's the first step that somebody that's having that pain and can no longer tolerate? Because I think a lot of dudes will just
try and live through the pain.
Yeah, live with it.
Non-steroidal anti-inflammatory, which aggravates a problem, but shuts down the healing process.
So once they can no longer deal with the pain
after the bones are splayed out.
Yeah. So they've waited so long. It's worse than it would have been had they addressed it in the first place. What's typical for that person to do? Like, who would they call?
Well, I think typically they'll probably end up with trying to deal with the pain.
So they go to a pain doctor.
No, they won't go to a pain doctor. They'll go to a chiropractor or a physical, maybe not even a physical therapist. They'll go to an acupuncturist or take whatever remedy that is suggested by probably one of their buddies that is doing the weightlifting with them.
Here, take this black market peptide. It'll solve all your problems.
Right, which will shut down all the inflammation and shut down the healing process, so that actually then their ligaments, their surfaces, their cartilage, their bones are not responding anymore to the challenge.
What should be done? What is the best course of action here?
Well, I think if it's a persistent problem, and even let's talk about the injury. The injury actually, most injuries being minor, are generally, the pain is generally related to kind of the damage that's occurring either to the cartilage, the bone, or the ligament, let's say, and let's leave the tendons off for the muscles. And, let's include the tendons because they're fibrous tissue. all of those different anatomic elements have been stretched out of place, and during that stretch, let's say for a strain or a sprain type of injury, then what has happened is that there's either been excessive stretching or extensive stretching and partial rupture of fibers that creates an inflammatory response that then subsequently initiates a healing response, and so on and so forth until the pain is gone. And generally that's a 10-day to 3 or 4 week process if it's not too bad. But then after that, if the ruptures in the ligaments and it's partial ruptures I'm talking about. I'm not talking about complete separation or anything.
I'm gonna barf.
Ligaments or
making my gag reflexes.
Tendons were to occur, then that needs a physician, needs to be evaluated by a physician.
What kind of physician?
Well, any physician at first, I suspect, because sprains and strains are the domain of any physician. But realistically, from my perspective, a better choice would be somebody that is familiar with the modalities that will help heal that type of injury.
You're talking about prolotherapy.
Well, yes, I think a regenerative physician would be probably preferable than to a physician that does regenerative medicine and or prolotherapy. Will be somebody that would be highly qualified to deal with those challenges and in a way that would allow the body to repair itself as opposed to either just cover up the pain.
Well, I think what's happening is those physicians that are seeing the patient on the front end are automatically referring that patient to an orthopedic surgeon. And an orthopedic surgeon's motivation is to provide surgery. But don't you think that surgery should be the last resort and not the first thing to get suggested?
Well, more and more now we have these options that allow us to stimulate the healing process that sometimes gets shut down in an impromptu manner because of inflammation, persistent inflammation. And so the healing doesn't continue to its full effect. So, but we now have the ability to stimulate those processes so that we can get virtually 100% repair. So that would be, I think, preferable than going and having a surgeon. And there are literally tons of studies out there since the late 90s to up to this day, and they're ongoing, that demonstrate either the equivalency or superiority of physical therapy even to a surgical intervention that would actually accelerate the deterioration of the joint and then long-term complications with arthritis, etc.
So the answer to my question was yes, surgery should be the last resort.
Yes.
Okay. Thank you for that clarification. Okay. So you were talking to another guy recently who was in a car wreck, and he didn't know what prolotherapy was, which was surprising because he works in the regenerative medicine field. I'm not going to give his name. It's not appropriate. But he specifically asked you what prolotherapy was.
Right.
Which I thought was interesting. So if he doesn't know what it is and he's surrounded by people who do regenerative medicine, other people might not know.
The regenerative medicine field is rightly or wrongly, has been in the popular domain, in the public domain, has been expanded more in the aesthetics world than it has been in end organ function.
Oh, like people who do Botox?
Well, Botox and injections, fillers, those things, facials that get rid of wrinkles and address.
Okay. The surface level.
Right.
things. Okay, go ahead.
So he was unaware of what that was specifically, because there are also many physicians out there, sports medicine doctors, and sometimes now even orthopedic surgeons and other surgeons that are capitalizing on the repair benefits of these products that are based off of stem cells or the content of the stem cells. So those people are typically, when they address, let's say, a shoulder, his problem is a shoulder. Let's say somebody had a rotator cuff, a small rotator cuff tear, or a labrum tear, or anything like that, or ligaments that are holding the any other ligament that's involved in the articulation around the shoulder. Those injections, rightly or wrongly, are addressed simply by a single injection of a product, and in the event that you have one area that becomes the dominant symptom provider, does not mean that none of the other ligaments were damaged. It just means simply that ligament, just like in a whiplash injury, everybody looks at the disc. They want to see if the disc is damaged, is displaced at all. And if there's a displacement, they focus on the disc and they forget about all of the literally the hundreds of ligaments, or the dozens of ligaments at one level that actually have undergone that same impact, that same force.
Well, that same guy wasn't aware that you could actually have pain in the ligaments. Somebody said that. Somebody said that they didn't think the ligaments carried pain or something.
Well, I think that was
no names. We're using people's names.
I wasn't going to say name.
Okay.
So that was I think a discussion about what is the source of pain when those things happen, and really the ligaments are the source of the pain, because they're more richly innervated in the and that is where the pain occurs. I mean, there's
but people don't
innervation in your cartilage, right? And it's only the periosteum that has innervation, so it's not the center of the bone that has innervation either. So you're talking about is where in that area that is traumatized, where is the pain coming from? And it's coming from where the ligaments are.
Got it. So you were talking about prolotherapy.
Oh, right. So prolotherapy is started back in the 30s and 40s, and has been used to inject, specifically inject ligaments or groups of ligaments that are at the origin of painful syndromes in virtually every joint in the body. And so it actually began with irritative solutions and evolved.
Like sugar water?
Well, it eventually evolved fairly quickly into the dominant practice being using different concentrations of
Don't be trying to inject yourselves with sugar water, people, by the way. Don't do that on your own.
Yeah, because this concentration, or the concentrations used for dextrose solutions are very specific for those for the levels you're injecting.
No simple syrup into the ligaments.
Oh dear. The bartender.
Right. Don't be getting creative.
Get the bartender.
Sorry. I'm sorry. My brain just went there.
Okay, so the concentrations are different depending on where you're injecting, and if you inject into the wrong area, obviously you could potentially have damage to nerves and tissue that you don't want to have damage, and particularly if it were the wrong concentration. So it started out with those, but it was codified really in the 50s, and was presented to the AMA and allowed to be codified for procedures, but at the same time, the dominant thought process at the time was, well, we need to be doing surgery on any kind of damage we find, and so it's been held in abeyance, I believe, a little bit because of maybe the mindset of the dominant procedures that are being provided. Ultimately, however, I think it's surfacing more and more that we know that that process, which actually ultimately became available to many doctors by virtue of palpation and using the anatomy as the source of the injections. Then using that is becoming more prevalent at this point, specifically because of the science that evolved, and we now know that about the response, the healing response, and the effect of stem cells and exosomes and those things, and subsequently, those injectates became available and have had in my hands a dramatic effect on helping patients, even with very severe arthritis, long-term arthritis, become ambulatory again and doing amazing things for themselves, getting back and getting their lives back from a ambulatory status and an activity status.
Yeah, I mean, we have some pretty cool stories. So the takeaway here is surgery is not your only option. Should be the last resort, we think, right? We would support that.
Well, yes, and certainly should be used in the appropriate setting, but those settings have not yet been elucidated by clinical trial work, and that's I think the challenge at this point is the mindset that everybody's going to an orthopedic surgeon and they're brilliant men and women, but at the same time, they were taught to cut, and that's what they want to do. And so
also insurance covers the cutting. I think that's also a problem, is that insurance covers the cutting. Insurance doesn't cover most regenerative. By the way, listener, if you get a regenerative medicine therapy, there is no code, no claim. Had multiple people try to get
insurance.
Right. Yeah. No insurance. Well, no insurance because there's no code.
Right.
So you can't file a claim if you have no code.
There's no insurance code for it. So
that's what I'm saying. No code, no claim. I've had to have that conversation with a couple of people. It's like going through this circle.
So I was going to give one last little statistic.
Okay, one last little statistic, but we're running over time.
The likelihood that someone gets surgery going when they are presented to the surgeon first off for an injury like that is about 45%.
Say that one more time.
The likelihood when going to a surgeon the first time for an evaluation for a trauma, even though it's maybe not your arm being pulled off or whatever.
Yeah.
The likelihood of surgery, even in minor cases, is significantly higher when you present to a surgeon
because they want to cut you.
Right. So it's about 45%.
So don't do that, people.
I'm giving the objective data.
Okay, I'm sorry.
If you don't mind.
I did. Go ahead.
And so about 45% or so. Whereas if your first point of contact is a physician that doesn't do surgery, or an acupuncturist or a chiropractor or somebody else that's going to do a more thorough evaluation, then your likelihood is probably about 10 to 15% of ending up in surgery. So those data in and of themselves also explain the excessive rate of arthroscopic surgery that's being done, most frequent surgical procedure in the United States, and they occur to the tune of a couple 100,000 procedures a year. And so thinking about the cost of care and how much we're spending on those procedures when we know by meta-analyses that at a year, at 12 months, arthroscopic surgery for minor arthroscopic or minor trauma to a joint is really no better than physical therapy at 12 months. Well, it's no better. In fact, physical therapy is better at 12 months than the arthroscopic procedure, and that arthroscopic procedures accelerate the probability of arthritis. Then those things ultimately play into the hands of regenerative medicine, which should be maybe the first point of contact for the diagnostic and recommendations, because I, as a prolotherapist and a regenerative medicine physician, actually, if I see something that necessitates surgery, I'm going to get them into the surgeon right away, and not just try and give them injections.
I mean, ideally,
yeah,
that's what you would do, but I guess there's really no guarantee that other doctors would do the same. So,
possibly.
Yeah. Okay. Well, listener, I hope you found this educational and informative and somewhat entertaining. And until next time.
Thanks for subscribing to Your Infinite Health. I'm Dr. Tripp.
And I'm LeNae. Until next time, feel it, look it, and live it.